for the station, just staring at me. I'm just like,
I don't know. Every time he's out there, I'm like, okay.
Especially because that joint just like flies, like it moves without you telling me to. And I'm just like, you know, I'm like my boss is watching.
Yeah.
And then I flew it on a second battery to try to get like just a little bit more, and it got low on battery, so it tried to start auto going home. But the GPS screwed up where takeoff was, and it tried to land it on the trailer home that had the roof ripped off. And I was like, can we please not? Like, please. What did I do to you? And Josh is like, is this supposed to happen? I'm like, no, Josh, this is not supposed to happen.
It's only because you're here.
Bless you.
Using a master is the worst thing.
It really is. And allergy season is here.
Better than in my face.
I missed you too.
I thought it was
Hi, how are you?
I miss you on the radio.
Thank you.
Did you get your time taken?
I did.
Do you know what it was?
97 something.
97 stuff. How's it going, Will?
Not too bad.
How many questions you got asked today?
Huh?
How many questions you got asked today?
Not so many actually. Not like a couple weeks ago. I really had a fun time with the question around.
That's a lot of questions.
It's just like, I had like 2
Oh,
sheets
all
of
right.
paper. Anyone want to hop in here?
Nobody else had the same question you did?
Well, either you did, you didn't ask it.
No. You know what I got a problem with? They're gonna have 2 hurricanes coming up into Florida, and you name the first one Martel, the second one should be called Polo.
Yeah, I was really, when Marco
Yeah,
was
that's an
coming in,
opportunity missed. No.
someone said Marco, and I was almost like, Tourette. Polo!
Thank you. Have a good day, everybody.
You too.
You too.
they can't hear me. Yeah.
I'm like, at this point, giving up and understand like where it works because there's no way I can get in my car and be free because at this point my car.
Oh, Lord. What kind of cats do you have?
I have one black cat and one tabby with me.
Cool. Apparently, the shedding type.
Things are short and cut will be the problem.
They're short hair and shed. Interesting. I grew up with both long hair and short hair. The long hair was always a problem. Gray hairball everywhere. Just like tumbleweed in the house.
Ready?
Yes.
Ready.
Good afternoon. I'm Dr. Sandra Martel, the Public Health Administrator for Winnebago County, and today I'm joined by Mayor Tom McNamara. I have a theme for today, and the theme for today is numbers count. So the first kind of where we're going to talk about numbers is back to school. Schools have started opening in Winnebago County, including Keith, South Beloit System, Rockford Lutheran, and Rockford Christian. All of our schools, though, have been getting ready to start and have been working hard to offer options of remote or in person. But regardless of whether you're a family that has chosen remote or in person, I'm going to remind you some other numbers. You need to get your routine vaccinations for all children. And children should receive their vaccinations through their medical home. But in recognizing that it's been hard to get to our medical homes, some of our primary care providers have restricted hours, or maybe it's been harder to come in if you're an essential worker. Health and Human Services has issued emergency rules allowing pharmacists to administer vaccine to ages 3 and above using American Committee on Immunization Practices schedule. Routine childhood physical exams should be done on all children. Make sure that you start a routine to get them ready for those early start times. Whether they're remote or in person, they need to be clocking in at school. Have them start going to bed earlier by the numbers and getting up earlier. And I know this is a challenge with high schoolers, but we've got to start so that our children are ready by the numbers. If you've chosen the in-person option for your child, please help your child to learn to wear masks so that they're ready to start for the school year. Make sure that you're using a child-sized mask. Let them pick out their mask. Do not use lanyards or any kind of ties around the necks of small children, as this could be a strangulation hazard. Let them put it on their stuffed animals and dolls. You can always wash them later, but the idea is to get them used to wearing a mask. Wear them in your home as a family, starting for shorter periods of time. 1 hour and gradually increasing to 5 hours, because that's the length of time they're going to be spending in school. And provide positive reinforcement for children. You can do stars on a checklist, letting them pick out a storybook in the evening. But again, by the numbers, help them increase the number of hours that they're spending wearing a mask. and model good behavior on masking. As we all know, our children learn more from watching us than they do from listening to us. And yes, to the children in the audience, you still need to brush your teeth, and you're not allowed to chew gum under those masks, according to the teachers. They can see through those masks. Help your child get ready for remote learning. It's just as important. Remember to set up a school space in your home for remote learning. I know that this is challenging in some places, but put aside a place where the child can get themselves logged in and ready to start their school day. Make sure to have your numbers of school supplies ready. They still need things like crayons and papers that support them in their remote learning. Because we want this to be a good year by the numbers. Winnebago County Health Department continues to update and post travel guidance on Tuesdays. And again, we're looking at the numbers related to infection rates higher than Illinois. And we continue to encourage. I know that there's been some discussion that the Centers for Disease Control has lifted any kind of travel restrictions or a need to quarantine. But as we look at our numbers, we want to continue to keep our numbers low. So if you're planning to travel to areas in which the numbers are higher, be deliberate and intentional. And understand that you might be required or asked to quarantine by your employer or best practice so that you can return and keep our numbers low in this area. The other thing we're going to talk about, again, numbers about seasonal influenza. You're going to start seeing that it's time to start getting vaccinated against regular seasonal influenza. Who thought we'd ever call it regular seasonal influenza, right? And again, flu vaccination is recommended for anyone 6 months of age and older. Pharmacies, again, will be able to vaccinate children 3 years and above. And remember that even though these vaccines, oftentimes I've heard this story, oh, they don't protect, it's not 100%, it reduces the severity of illness in those who contract influenza. And I remind the public again that we don't want to have to fight off both seasonal influenza and COVID co-infection. Anticipating vaccine, again, at the end of our calendar year, for the optimist in me, is that we are going to be seeing some of those vaccine trials and some vaccine coming out at the end of this calendar year, beginning of next. We would not want you to delay or postpone your COVID-19 vaccine to get your seasonal flu. So once your doctor's offices have it, when you see the pharmacies have it, get vaccinated against seasonal flu. And for those children who are returning to remote or to in-person learning, it becomes doubly important because, again, we want to protect them against transmission of flu in the classroom environment. Another number to think about is the number of those of us who do not vote on a regular basis. The pandemic is not over. If you're in a vulnerable population, request a mail-in ballot. Your vote counts, and those numbers matter. Another number that we're worried about is our census numbers. Completion. Communities of concern. Listen up here. You've been impacted by higher rates of COVID-19 and other negative social determinants of health, including housing, poverty, educational attainment, and employment. And you've also contributed to lower census completion rates. Do your part. I'm going to give some zip codes out here and some census tracts and tell you what the completion rates are. Zip code 61101, 61102, 61103, and 61104. The numbers are on the table for you. I'm challenging you to get your numbers up. Anywhere in those census tracts from 10, 11, 12, 13, 18, 25, 26, 27, completion rates are running at less than 50%. That means we're counting at less than 50%. And these same communities have twice the infection rate. So don't count yourself and undersell you and your community by twice. Please complete the census. And the deadline for the completion is September 30th. We're close and closing in on that date as well. Your household counts. Another positive number to report are we added 11 new members to the team for case investigation and contact tracing who started with the Winnebago County Health Department on Monday, August 17th. Hiring continues with the goal of bringing all 51 on board by September 30th. We ask for ongoing cooperation of the community to answer their calls and provide the necessary information to help prevent the spread of COVID-19. It is through your participation, cooperation, and effort that we've been able to identify cases, contacts, and been able to keep our infections low. And with that, I'm going to give you the numbers for today, our last and kind of final discussion on numbers. Today we're reporting 17 new cases, which brings our total count to 4,087. Our positivity rate is going up very slightly, but 3.9%. Our recovery rate is at 96%. But once again, we have one additional death to report, and our community mourns the loss of one member. No matter how small the number, we continue to mourn those losses. Our total deaths remain at 148. We have no new locations of concern, and one location of concern will be coming off. We anticipate that Winnebago County will be turning orange for critical for new cases per 100,000 for the week ending August 22nd. And we look around our region, we look around our state. Today you heard that Regions 4 and Region 7 are having to implement additional interventions based on the tiered strategies, including the reducing hours, reducing capacity, and closures in bars and restaurants to internal services. But we have to do our part in Region 1 to keep our numbers low. We have to be vigilant. We have worked way too hard. I don't want to give up in the last quarter mile of this marathon. I don't want to have to give up the opportunity for in-person learning and education in our community. So we must continue to wear face coverings and masks when out in public. You heard the new requirement that when you're at a bar or restaurant, when you're in contact with someone who is not a member of your household, they come to serve you or you go up through the drive-up window, you should be wearing your face covering. Maintaining physical or social distancing of at least 6 feet. We need to wash our hands and clean and sanitize frequently touch surfaces. If we do these things, we can keep our numbers low. So with that, I'm going to turn it over to Mayor McNamara.
Thank you, Dr. Martel, and again, just thank you and a deep appreciation from all Winnebago County residents for the work that you've been doing. A special thank you to you, all the superintendents, all the principals, teachers who have been working so hard to get our schools ready to open either virtually or in person, in most cases both. I do want to just mention a couple of things regarding the schools. We talked a lot about our frontline workers as the pandemic really started to get going. We talked about the cashiers at the grocery store. We talked about the truckers who were bringing goods and services into our community. We talked about all of those frontline workers. Well, now the season has changed that many of these new frontline workers are teachers. They're the superintendents, the principals, the staff members. I just want to make sure that all parents and all students have some patience. These folks did not sign up for this when they began these careers. No one expected to have a school year like we're about to have. We are in unparalleled times, and just show some patience and some consideration of the work that they're doing. They're really on the front lines, risking themselves, their self-health for the education of our next generation, to which we need so badly. And to those students, no one's went through a school year like you have, or that you're about to go through. Make sure that you soak up all the education that you can. If you're working remotely, make sure that you set yourself some daily goals that you can work through to achieve each day, because it's going to take a special dedication from you to improve your own education over this next school year. So I just want to say a sincere thank you, and a special thank you, I should add, to parents. You always are in a difficult position when school year starts, and this year is really unlike any other. If you're a parent who is dropping off a student to a university or college, that can be incredibly stressful in the best of years to drop off that student and maybe drop off that student for the first time. Now you're dropping them off in the midst of this global pandemic with all of the health concerns. Know that you have a community that's here to support you and care for you, and know that we're all here to cheer on your student who is going off to college. We have been now standing before you for about 6 months, educating you on the importance of some very basic principles that all of us can do. And I kind of, if Chairman Haney was here, he'd probably use a sports analogy for this, and I'll just simply say, we are on one single team as a county, and each of us has a role, and that role is incredibly simple, and we can't stress it enough. Now, as Dr. Martel said, it is that time to just continue to be vigilant. So if you have an activity at your house, you're going to an event or an activity, if it can be taken outside, take it outside. It helps reduce everyone's risk, yours as well as those other family and friends who are gathering. So take it outside. Second is make sure that you're wearing your face covering when you're out in public, when you're interacting with people outside your household. It protects you, it protects them. Make sure this is a simple thing that you can do. Next, make sure that you're washing your hands frequently, and make sure that you practice social distancing. I think at the beginning, no one knew what social distancing really was, but now that everyone is well aware that you have to spread apart 6 feet, at least 6 feet, it's really simple to do, so please practice social distancing. Last thing, and I'll build off what Dr. Martel said, we have 37 days left of the census. We have been dealing with struggles with the census over the last several different census counts. We've historically underperformed. This year we had a tremendous team and a regional effort led by R1. And this team had well thought out plans. Obviously, much of that got thrown out the window, and we had to adapt quickly to having the census completed during a global pandemic. I want to say a huge thank you to the teams throughout the region who have come together to help build a coalition to get the word about the census out. But now it's on all of us, all citizens. I'll be honest, I'm a little bit selfish and care a little bit more about the Rockford citizens completing their census, but all citizens, it takes you 6 minutes to go online. And I can attest, it took me 6 minutes for a family of 4 to go online. And you can simply go to my2020census.gov. You can also call 844-330-2020, 844-330-2020. If you call Rockford home, you count. If you call our region home, you count. Take the 6 minutes. Complete the census. Dr. Martel already stated the struggles that so many people are facing in our community, and you can look at those zip codes. You can look at the census tract and see where many of the social determinants of health are having the greatest negative impact on individuals, and you can see that those are the exact same places that we need our census numbers to improve. So we are going to continue to do our part to get the word out. We do need you to spend 6 minutes. If you own a small business, share the link with your employees. Don't assume that all your employees have completed. Help our community, help our region out by spreading the word. If you're in a church group, share it with your Bible study. Share it with the youth group. Make sure that every single person is completing the census. And with that, we'll take questions.
Dr. Martel, can I get your comments, your reaction on the additional requirements for restaurants and bars, for patrons in restaurants and bars that were announced today? And if you think that will be difficult to enforce?
Well, the question was my take on the additional requirements that the governor announced today. Well, first of all, I want to applaud our community. We've been doing it for a long time. We talk whenever you are out in public, whenever you are not with someone in your household, that you should wear a face covering. So this goes to the next. I think most of us don't think about it when we pull up through a drive-through or when someone is coming to the table to quickly put our mask on when the server asks us for our orders. And so again, I come back to, we cannot police ourselves out of a pandemic. We have to rely on each other to do the right thing. And I keep coming back to this because it's the right thing to do. But we have students that are returning. When I think about our population, they watch everything we do. And if they don't see us wearing our masks, no matter how many times we tell them, this will be a very challenging school year. And so we've got to model that positive behavior. We protect, again, we call it source control. We protect, others, and we protect ourselves. So it's a simple thing to do. I remind everyone to do it. Heighten the expectation. If you see someone approach you without it, put your face covering on, move your 6 feet away, so that it's clear that your expectation of them is that they will wear their face covering and you are going to wear yours. We do handle all of as we know, we have enforcement activities that go on. We do respond to complaints in the community. But oftentimes, when we go back out to educate, the individuals are doing the right thing. So again, I always say, if you notice someone is, step away, don't get into a confrontation with them, put your face covering on, or move out of that direction so that they're clear that your expectation is that they will be wearing a face covering and you will wear yours.
You gave an analogy during your opening remarks about being in the fourth quarter, toward the end of this marathon. Are you optimistic that we are on the verge, getting close?
Every day we hear good news coming out about the vaccine trials. We have a group and team that is what we call advanced planning. I'm not going to call it mass vaccination because I want people to understand I'm not going to bring you all together after I've worked so hard to keep you socially and physically distanced. So we're going to call it population vaccination. And again, we've worked so hard to keep our community safe, to be able to keep our businesses going strong, that we don't have to put additional mitigation strategies in. And so we are going to have these sprints during the marathon. We are getting close. We have worked very hard. And I come back to, we're getting to our children back into the school system. We cannot let our guard down so that our infection rates climb. As we know, there are metrics associated with schools going to all remote or all, online education. And so it becomes very important for us to continue to work on that.
You mentioned that it looks like we're going back to the orange for cases by 100,000, if I'm not mistaken.
Mm-hmm.
So you anticipate that Winnebago County will go back to that warning stage in the coming days then?
We expect that based on total number of positive cases, but not positivity rate. So remember, I've been very upfront with you. We've encouraged people to get testing. Our community has been one of the strongest in getting tested, and I think that's an important kind of concept for our community. Was not afraid to go and learn their status and then take the appropriate actions that need to be taken. But it also increases number of positive cases, but does not increase our overall positivity rate. When you look at the other counties that have gone into the critical portions, they are having increases in positivity rate and outbreaks associated at businesses and restaurants and food establishments and things like that that have contributed to that. There was also concerns in the region about travel from outside, and I know it's been very hard for people when we had the travel guidance out. They say, you mean I can't travel to this place and I have to quarantine when I come back? And the recommendation, we did not have the ability to put a travel ban, so I want to be clear about that. We've been doing this at the end of June, recognizing that if we travel to other locations where face coverings were not required, where the infection rates were higher, we could bring that back into our community.
So I guess the takeaway from this is that you're not concerned about, technically by a numbers basis, we're going back to the warning stage then?
When you say the question is, am I concerned about us going into that? I'm obviously always concerned and continue to monitor every portion of that. And I want to come back to our community, though, that you need to be doing the right thing. You need to continue to do what it is to prevent the transmission of this infection. If the numbers continue to rise, yes, I will be coming back out and saying, what else can we do differently? What do we need to put in place to more stringently identify those social mitigation and continue to push forward on those?
But you'd be more concerned with an increase in the positivity rate.
along with an increase in number of positive cases. Obviously, increasing death rate, we've talked about that before. And you'll see some new metrics aligned with schools. We talked about that briefly last time. We're going to be watching the infection rates especially in the school-age children population, right? As we return children to an in-person education environment, we do expect that there will be some cases. If we get significant rises in cases or in a particular school, we will also be very concerned about those metrics.
Schools to this point, some, especially high schools, are getting about the 1 week mark, I believe, on tomorrow. In fact, do we know of any positive cases at this point from the reopening of schools in the area?
At this time, we have had some positive cases, and the schools have noticed appropriately. And I'm going to say we've also had very vigilant school nurses in each of the districts. And I think that when we talk about this to the parents, I know this will be a very hard year. We've talked about not powering through, not sending your sick child to school. If a child appears with any one symptom, they are then being pulled out, and we're going to call it isolation just for the term so everyone's clear, so that they're not exposed to others, with the idea being that we will rule out COVID because we cannot let them stay in a classroom environment where they might expose others in that particular environment. In each of the cases that we've looked at so far, and when I say cases or concerns where it was brought to our attention, the school is practicing face coverings, social distancing, and had really minimized the potential or exposures that occurred in those environments. And so again, we applaud the work that's been done.
So what is some positive cases? What is the number then?
In terms of schools, we can get that, in terms of identifying, we've had a staff member in one of our school districts. In fact, it's been mostly staff members at this point returning to the environment.
Mayor McNamara, I have a question not entirely COVID related. We've talked a lot about civil unrest kind of going in line right around the timeline of COVID as well. Obviously, another major national event taking place over this past weekend. We've seen protests kind of scale up again and again last night going to District 2. Overtime for the police is starting to go, further and further. As you've stuck to kind of this ideal of people are fine to protest however they want, but as your views on this, especially as protests continue to happen in the Rockford area, are your views staying the same? What's kind of...
What do you mean by that?
Well, you've said throughout, since this has started, you've always supported the people's right to protest peacefully here. But as we see, these continuing protests continue to happen, for the longest, I'd say that we've seen in Rockford a continued protest like this. We've seen the police budget continue to get pushed more and more, especially with overtime. Have your views on these continued protests in Rockford changed at all?
Okay. When I repeat this, make sure I get your question accurate.
By all means.
So the question was just posed over the course of the protests. They've lasted, in your opinion, longer than most protests that you can recall in Rockford. And with the increase of potential overtime and things of that nature, has my views on protests changed?
I guess the specific protest, not just protests in general. But
okay.
Yes, I'd say that's largely the question. Yes.
Okay. No, I mean, that's everyone's right to protest and have their voices heard. So no, absolutely not. My view on individuals raising their voices and bringing concerns to light has not changed. Everyone's entitled to that, and we as a city government, that's part of our job, is to protect their right. I will be upfront and tell you the last I reviewed those numbers, I want to say was last Thursday or last Friday, and if my memory serves me correct, we were at $1.64 million of combined overtime for the police, and we had budgeted $2.7 million for the year, and I believe we were at 61% of our budget and right in line with that. So it has not dramatically increased our budget. It actually hasn't increased our budget from the numbers we budgeted at the beginning of the year. But no, everyone has the right to protest, and there are really important conversations taking place, and I've been fortunate to have been part of many of those conversations. And obviously, it's a really challenging time across the country and right here in Rockford, but it's also an unbelievable opportunity. I think you can look at many of the threads that bind us together, and one of those is safety, and safety just happens to mean different things to different people. And I think if we can focus on those threads that bind us together, we can move forward and move forward as a stronger, more inclusive, more just community. And I think you have folks who, I think as a community, we need to understand that reform and safety are not mutually exclusive. I think you can look over the work that the city of Rockford has done in our police department and be incredibly proud of it, as I am. I think you can look at how, and I'll just speak for those instances that I've had the opportunity and honor to play a small role in, but you can look at how we analyzed our calls for service and saw that, at the time, 35% of our calls for service were domestic violence related. And of those juveniles we arrested for violent offenses in the last 3 years, 60 to 75% of them grew up in households that domestic violence was taking place, and they had been impacted by trauma. And you can see that our police reviewed that. They worked with the Mayor's Office of Domestic Violence and Human Trafficking Prevention, headed by Jennifer Cacciapaglia, and realigned and reimagined what policing would be in domestic violence cases. So now we've moved forward with the Family Peace Center that just opened 3.5 weeks ago. We have hired staff to work with those youth impacted by trauma, which is headed up by Annie Hobson, and we're always open for new ways. We just need to continue to be open for new ways to reimagine and realign our resources to best serve all Rockfordians and keep all Rockfordians safe.
Mayor, do you have any comment about the incident in Kenosha which triggered the violent protests in the last couple of days?
So I think probably watched that a number of times, and probably one too many times, like most Americans have seen. So the question was, Ken asked what my thoughts were about the incident in Kenosha, Wisconsin. I think anyone who watches that has to have their heart tugged at some point. I think it's horrific what I saw, and knowing Ken, I've seen that clip that everyone's seen, so I just want that out there. But it's horrific. I think 7 shots to someone's back. I don't know of a better word than to describe it as horrific. I think I would just say that incident in itself is horrific. We have had a number of listening sessions throughout our community. I would just add, I mean, so I have 2 young kids, Olympia and Malachi. To my knowledge, and I'm not an expert on this case, but to my knowledge, there was 3 children in that car. I mean, my heart goes out to them and to the entire family. That one hit me hard and was, I think, and I hope, difficult for everyone to watch because that's not how things should take place, in my opinion. Understand I'm not an expert, but I don't know if you need to be to watch that. I would say we've had really impactful listening sessions here. We as a community have a lot of work to do. And I will say you all have done a tremendous job covering different events and work that is being done, both positive, just events, I'll say. I would just give a word of caution to Rockfordians overall. Watch your language that you use. Words matter. One of the worst things to read is a comment section of any of your articles. And that's nothing that you did. Obviously, I'm talking to media. It's nothing that you did, and I know that. But there is so much hate in those comments that is not productive, that is not going to bring us together. I mean, you talk about things that we need right now in our community. is we need to start treating our neighbors how we want to be treated. It's very simple things. It's just like the COVID mitigation efforts that we could all do. It's simple, basic human things that as schools open, they're going to teach 3- and 4-year-olds and 5- and 6-year-olds what to do, to treat other people how you want to be treated. And that's things that we can do right now to start building a stronger, more productive dialogue. And understand, Rockford's a small town. You're using your own name out there with this hateful speech on both sides. We right now need to come together and, again, focus on those things that bind us together, because there is far more of that garment that binds us together than tears us apart. And so I know you didn't ask me that, but after watching some of the comments recently, it's hard not to comment on it.
And I know you're not used to the public health administrator talking about this, but violence was recognized in our last community health improvement plan, which was 5 years ago, and was kind of subsequently in previous years as well identified. And one of the underlying concepts is this concept of trauma. And, you know, and again, we talk about children learn more from what they see, more than anything we talk about. But we have to be thoughtful if we're going to raise a resilient community that will have come out of a pandemic, that will come out of this era of social unrest and civil discourse, that we need to then be modeling the behavior. They are our asset. They are, our most valuable and precious commodity, I'm going to call it, is what it is, our resource, our environment. And we need to, if a child witnesses violence, we know that that is one of the most significant triggers and predictors of health consequences and outcomes. And so, similar, when a child witnesses and observes violence, we have to be working twice as hard. And so you hear some of the schools are figuring out how to do what they call support services throughout the year in addition to their classroom, to recognize that children have been in some of these situations and environments during the stay-at-home orders and have been out in the community during all of this, and that we need to work through that with them so that we can help to build a resiliency, to help be able to process some of those observations that they have made throughout that. And so while we return to both remote and in-person learning, those opportunities are being provided by the schools, and there's been a lot of discussion for not only about the curriculum and how do we make sure everyone gets logged in for class, but how do we address the trauma that's been occurring throughout our community. So I think that that's a very important factor. And I think the schools have really been as creative as they can. We know that they are working on things like, I'm going to say, the trauma-informed classroom. They're used to having comfy chairs and places where children can go and get comfort, and they're figuring out different ways to do this in this new physically distanced but not emotionally distanced world that we're going to be in. And so whatever you can do to support children in this environment as they move, you can imagine they have concerns about, is it safe? Are my parents safe at home? We've heard that children are worried about their parents getting sick if they come back. We need to really help, again, as adults, as responsible individuals in our community, to model the behavior that we want it to be. And again, I want to come back. There was another question that was asked about, we will be putting the school names out as locations of concern on Fridays, as we would with our weekly report. So if we have, but remember, we're always going to notice the schools first and the families involved before we're going to notice the media. Because again, as responsible caregivers and parents, we need to understand what's happening in our child's learning environment before it goes to the public and media. So that's kind of our commitment to the families in our community, so that they can understand and help prepare for their children, as well then as our transparency to the public and the community at large.
Any other questions? Thank you.